Happy Tuesday. My name is David Riley. I'm a reproductive endocrinologist. I work at Boston IVF, and I think today's Instagram live talk, which for a boomer like me is kind of unusual, is about egg freezing, its purposes, what it means, and how it's done. So, what is egg freezing? Egg freezing is done for individuals who want to preserve their fertility. It's an insurance policy, meaning it assures you if you start having children later in life and you're trying to build your family, you may need eggs that were frozen when you were younger. So that's what egg freezing is all about. So for instance, just for the purpose of illustration, an individual might want to start building their family with their partner in their late 30s. And they may have no problems attempting conception, meaning the presumption is they are fertile. And that baby is going to be carried for 9 months. That baby is going to be breastfed for 12 months. And they're with their partner and they've decided to further build their family. In so doing, they might find, because of their more advanced reproductive age, that they might be infertile, and they come to a reproductive endocrinologist, and that reproductive endocrinologist says, yeah, you need an egg donor because you're building your family later in life. So that's essentially why you freeze eggs. You're freezing them in the event that you foresee that you're building your family later in life. So in other words, you might never need to freeze your eggs. It's an elective process. It doesn't have to be done. But it does provide a level of reassurance that if in your life, for whatever personal, professional, or medical reasons that you have to wait, you are making sure that you can optimize your future fertility. That's essentially why it's done. And I mentioned personal, professional, and medical reasons. One of those medical reasons, unfortunately, is cancer. So essentially my main job, or one of my main jobs at Boston IVF, is fertility preservations for patients who are going to face cancer treatments. And this is the opportunity for those patients to preserve fertility that is allowing them to overcome the potential impact of the cancer treatments they might receive. That impact can make them have a significantly diminished ovarian reserve in the future because it impacts their ovaries. But this allows them to focus on getting pregnant with their own gametes, despite the fact that they have had cancer treatments. The point I'm trying to make is there's many reasons to freeze eggs. One, to preserve fertility for personal reasons. Two, for medical reasons. And it's highly successful. How does the process work? I'll try not to sound too biochemical and scientific. My nurses constantly accuse me of doing that, so I don't want to confuse people, but here's how it works. Every month an individual ovulates. The pituitary gland, a gland up towards the brain, produces a hormone, secretes that hormone into the bloodstream. That hormone is called FSH, follicle stimulating hormone. When you hear me use the word follicle, think egg. So every month of an individual's menstrual cycles, from puberty up until menopause, there's a group of eggs that have the capacity to ovulate, meaning in that month, there's a group of eggs or follicles that have the capacity to respond to the FSH. And the consequence of that is that the FSH out of that group that's ready is going to allow an egg to be released. And all the other eggs in that group will die off. And each month this continues. One egg is released, all the others die off. When you're freezing eggs, what you're doing, we are offering you the FSH medication, meaning we're increasing the concentration in your bloodstream, meaning out of the group of eggs that are ready, we're going to prevent them from dying off. So if the natural process is one gets released and the rest die off, all we're doing is saving the eggs that your body is losing in that month. And that's a really important point, because so often patients are under the false impression that by doing egg freezing, you're going to deplete the overall supply of eggs for the future. You're not, because that would enhance or perpetuate infertility. That's not what we're doing. We're saving the eggs that your body is losing in that month. And that's how it works. And therefore, you're saving eggs at a young age that can be used to create embryos in the future. How does the process work? Well, when individuals undergo egg freezing, they are taking that FSH medication. That FSH medication is administered as a superficial shot in the skin, much like individuals who take insulin, for instance, for diabetes. You take that medication on a nightly basis. You're taught how to do it. It's essentially painless, on a nightly basis over a course of 9 or 10 days. During those 9 or 10 days, the only change in your activity is no high-impact exercise, meaning no jogging, no jumping up and down. But otherwise, there's really no change in your employment and your lifestyle. During those 9 or 10 days, you'd come in to the office approximately 3 times. We do it early in the morning before you have to get to work. We open up at 6:30, and you come in for what's a 5-minute blood test and an ultrasound. The ultrasound is done vaginally. So a thin wand is lubricated, it's inserted, and the ovaries are scanned, and it takes about a minute. So you're doing that about 3 times during the course of treatment that you're taking the medications. And after about 9 or 10 days of those meds, I review those ultrasounds, and I see that the follicles, the other ones, the areas that are growing the eggs, are ready, and you take the final dose of medication, and 2 days later, the eggs are retrieved. That's a day off from work. So in other words, it's 9 or 10 days of the essentially painless superficial shots and a day off from work. The egg retrieval is done at an outpatient surgery center, and it takes about 10 minutes. The patient is given a sedative through an IV, so that patient is sound asleep. They neither feel nor remember a thing. It's the same kind of anesthesia that individuals get when they have colonoscopies, which happens to be the most commonly performed outpatient procedure. It doesn't involve general anesthesia like major surgery. This is the same kind of modus operandi. It's just a intravenous sedative. And while sleeping, not feeling nor remembering a thing, the patient is placed in stirrups like that patient gets when there's an exam. And during the time that that patient is asleep, a probe with a needle attached to it is placed in the vagina and guided by ultrasound to drain the follicles. It takes about 10 minutes. The individual wakes up and goes home. That individual is told how many eggs were retrieved and the success or not of the cycle. And the bottom line is that the success of the cycle is dictated by how many eggs are retrieved. So for instance, someday, if, and that's an if, the patient needs to use those eggs, the eggs would be thawed. 95% of the eggs would survive the thaw. Of those that survive, they would be injected with sperm, 70% fertilized. So they now become embryos. And those embryos, we watch them grow to a stage of development, day 5 or day 6 of their development, when they're called blastocysts, and those are all frozen. So in other words, you've created a bank of embryos, known as blastocysts, from the original lot of frozen thawed eggs. And each one of those blastocysts, when they're thawed and transferred into the uterus, confers a certain live birth rate based on the age the patient was when the eggs were retrieved. The younger the patient at the time of the egg retrieval, the more successful the thaw and transfer of that embryo would be. The transfer process is relatively simple. A speculum is placed in the vagina. There's an ultrasound on the abdomen. You watch the embryo go in, and you get a pregnancy test 10 days later. And typically, for individuals under the age of 35 who froze their eggs at that time, they will have the highest rate of success from the transfer of the embryos derived from those frozen thawed eggs. The older you are, particularly over the age of 35, it's a less successful process, and you need more eggs to create enough embryos to have relative assurance that future use of embryos derived from those eggs would work. So the optimal time to do it is when you're under age 35. Unfortunately, insurance often doesn't cover egg freezing, and I think that's very unfortunate because many individuals aren't ready to do it until they're really focusing on the fact that they've yet to have children, they want to build their family, they may not have a partner, and they're doing it at a time in their life, their reproductive lifespan, where it's less successful. Other reasons you can freeze eggs is not just medical, and it's not just because you haven't met the right partner. It can be used for individuals who may be transgendered, and before they complete the process of becoming transgendered, they may want their eggs retrieved because they are interested in having genetically related children in the future. So there's many reasons that this can be done, and I find it, especially as a gay man, very rewarding that we can build families for individuals who eventually want to provide an environment that a child can be loved and therefore thrived. And there's many ways to define a family. I'm going to answer some of the questions that have been posed in anticipation of today's discussion. One of the questions is the success rate better with eggs versus embryos? So I think the nature of that question reflects the fact that many individuals undergoing these treatments are not preserving their fertility, they're undergoing infertility treatment. So they are creating embryos at the time of eggs being retrieved. Embryos can be transferred into the uterus at that time, as well as surplus embryos are frozen. The data is pretty good that for individuals under the age of 35, egg freezing success, meaning when you create embryos, if it needs to be done, from eggs that are previously frozen, success rates between embryos being transferred from those frozen eggs or eggs that are fresh are similar, which is one of the reasons since 2012 egg freezing is no longer considered experimental, because the success rates for that younger cohort of individuals is better. But again, too often, or unfortunately very often, patients may be waiting. But success rates are similar for patients under the age of 35. Another question that I had received was, how long can eggs be frozen? In perpetuity. They can be frozen as long as it's needed until an individual might need to use those eggs. Eggs can be transported. You may have an egg freeze cycle done at Boston IVF, but you move to California and you can't come back to Boston IVF, and those eggs can be transported to reproductive endocrinologists and centers that know how to thaw those eggs and utilize them for you in the future. Another question is, do you have to thaw embryos to assess pre-implantation genetic testing? And that's where you're checking chromosomes. And the nature of this question pertains to the following. As individuals get older, more of the eggs they produce have an abnormal number of chromosomes. So what am I talking about? Well, every cell in our body has 46 chromosomes. It's where our DNA is packaged. Within each cell, essentially, there's 23 pairs, and within each pair, one chromosome comes from our mom, one chromosome comes from our dad. So what makes a healthy embryo that is more likely not to miscarry and carry to term, the embryos need to be chromosomally normal. Okay, one would love to be able to test eggs. Can we check the chromosomes? You cannot. You can only test embryos. So in the future, if you thawed eggs and you created the embryos, those embryos, the chromosomes could be tested before the embryos are frozen. And therefore, you're going to be able to choose embryos based on that genetic testing that are more likely to lead to a successful live birth when the embryo is transferred into the uterus, because when they're chromosomally normal, they have a normal number of chromosomes, they're less likely to miscarry and therefore confer a higher live birth rate. The other question is, I think I already answered, are outcomes better for eggs or embryos? Certainly, some of the data on eggs that I've been somewhat quoting is imprecise because not enough women have come back to utilize their eggs. And so we try to overcompensate when we freeze eggs to make sure there's enough that in the future, when they're thawed, fertilized, and the embryos are created, there's a reasonable chance of success that the success of transferring those embryos into the uterus from a group of frozen thawed eggs will equal what embryos were created at the time of a fresh egg retrieval. The point I'm trying to make is that in younger individuals, egg freezing with future fertilization and embryo creation is equal in success to embryo freezing. But no matter when you thaw eggs, and no matter what age you might be when those eggs were created, the embryos derived from the eggs that are fertilized will have the same success rate at embryos that were created fresh if the genetics are tested. So if you test the chromosomes, once you create those embryos, the live birth rate is the same. But when you're older, a lot more of the embryos aren't chromosomally normal. So not meant to confuse you. Number one, egg freezing, really successful for younger women, particularly under age 35. But when you genetically test embryos derived from frozen eggs, they have a very high success rate equal to fresh embryos, meaning embryos derived from fresh eggs whose genetics were tested. But you have to create more because more of them might be abnormal the older you get. So in essence, egg freezing is exciting. It's providing women with an opportunity for whatever medical, professional, personal reason, or individuals for whatever medical, personal, professional reason need to preserve their fertility so they can build their family in the future. It is a wonderful process that affords them the opportunity to do so. I am incredibly frustrated by the fact that insurance companies don't recognize how successful this process is, and someday we might live in a world where they do recognize it. But it allows individuals, as they get older, to know that for whatever circumstances they find themselves in, they've been able to give themselves the best opportunity to have a genetic child for the future, especially if they've had to defer their childbearing later in life. Boston IVF is one of the world leaders on freezing eggs. It was some of the data that came out of this institution that was part of the process that led in 2012 the American Society of Reproductive Medicine recognizing that this process and these procedures no longer needed to be considered experimental. So I want to thank everybody for taking the time to listen to the process of egg freezing. I hope this was successful. I hope I answered the questions somewhat accurately, and I wish everybody a very nice Tuesday and a very nice day. Thank you.